Test. Testing 1, 2, 3, 4. Okay, I'll go ahead. Start the roll call. Everybody is present. Attest to publication.
I saw it.
Thank you. Approval of the agenda.
I make a motion to approve the agenda? Oh,
Oh,
I make a motion to approve the agenda without the student report?
Second.
motion made by Shelley, seconded by Joni to approve the agenda without the student report. All in favor?
Aye.
Opposed? Motion carried. Tina will read the mission, vision, and values and the Board of Education collective commitments.
Bangor, Bangor School District, Bangor Pride, a small school building big futures, an innovative small school creating excellence through personalized learning and relationships for all, student-centered safety, opportunity for all, small class sizes, fiscally sustainable, foster community, continuous improvement, and professionalism. Then for the statement, as a member of the Bangor School Board, I will be an active listener who is open-minded, respectful, and inquisitive. Together with one collective voice, we are committed to forward thinking while strategically prioritizing for our students, staff, and community now and into the future.
Thank you, Tina. Public comments? Moving on, approval of the minutes from the January 12th regular meeting.
I move to approve the minutes for the January 12th regular meeting.
Second that?
Motion made by Joni, seconded by Tina to approve the minutes for January 12th regular meeting. All in favor?
Aye.
Opposed? Motion carried. Thank you. January 12th closed session.
I'll make a motion to approve the closed session minutes.
I'll second that.
Motion made by Lori, seconded by Shelley to approve the closed session minutes from January 12th. All in favor?
Aye.
Aye.
Opposed? Motion carried. Special reports, the students are not with us tonight. Board President's report, correspondence, thank you from the Mayo Clinic Child Life Program. Is that in our packet? Okay. Okay, thank you. Okay, committee report, PRC. Joni?
We met on, I believe it was February 1st. We had a list. We're still trying to clean up volume 30, which is part of 2021, or actually maybe even 2020. 2021 policy updates. There was an entire section that hopefully everybody renewed on the non-discrimination, and they are all legal updates. So while we did look at them, there was not any changes because they are all based on legal requirements. And then we also, wasn't any major changes, a lot of, just updating language and updating the most common or the most up-to-date definition of, language, I guess is the best I can say it.
Any questions for Joni and the committee?
I
All
can
right.
just real quickly report that I believe we have one more that we'll get through here in the next couple months, and that we will be completely caught up. So that's a good thing. It's been kind of a busy year with policy, but we've got one more that we'll be able to get through and be done for the year.
Thank you. District financials.
There were a couple questions asked, one specifically about $500,000 check, which is a good thing to ask about. That's basically taking from one bank and document change from one to another. Another question about the YMCA and some payments there. That is for some of employee wellness incentives that we pay a portion of their membership to the YMCA. There was a $6,401 repair to air conditioning made that was questioned in the labeled, I think, as a maintenance item or whatever it may be. That was the air conditioner over at the elementary that was out right as school was starting, end of summer school starting. So just finally clearing through. So other than that, I think people had an opportunity with the questions. If there's any other ones, otherwise we'd look for a motion to approve the financial.
I move to approve the financials as presented.
I'll second that.
Motion made by Joni, seconded by Shelley to approve the financials as presented. All in favor?
Aye.
Opposed? Motion carried. Thank you. District reports, informational, open enrollment window notification.
Yeah, just I felt it was important to talk about the open enrollment window being open. This is per state law, communicating out. There's a news release there if parents had questions on that. You know, as you know, we are pretty close to even on our open enrollment, give or take, I think 6 kids right now, 4 or 6 kids. We obviously want to continue to grow that number in our favor. We're more here than leaving. This is that window of opportunity for families too. And I know our principals are always ready, and I'm always ready to give a tour of the district and kind of show off the amazing things happening in our district. And we're proud of what we do, and we think we do it pretty well. But we'd like to continue to share that if people are interested in open enrolling into the Bangor School District. So just wanted to make sure that people know that that window is open, and if they have questions, they can reach out to any of us here at school and we'll help them out.
Any questions? Okay, thank you. District action agenda, COVID-19 response plan update.
Yeah, what a shift and change we have seen in our COVID response or our COVID plan, our excuse me, COVID numbers, and hopefully we can represent that, follow that in our planning here tonight. So just a couple of things. I've kind of given you those averages and some of those total numbers for the year. We have 1 active case in the district right now. That is the 1 case that we have had in the district since the 7th, so last Tuesday or last Monday. We've had 1 new case in that time. So those are numbers, the types of numbers that we want to see. Lots of zeros coming in there. Our line flattening out as far as that total. So interesting. If you remember back when, I think probably December when we talked about this, we were averaging about 4.23 cases, active cases per day. That didn't mean those were new cases every day, but that was how many kids were, or, staff and students were affected a day. So just thinking of those numbers a little bit, our average now after January it has raised to 8.31. So it doubled based on a surge in January. Prior to our holiday break, that average had moved its way to 5.73. So just giving an idea of where we were active cases per day. At the end of January, that had raised to 8.89 active cases per day for the whole year, and then back to the 8.31 as of today. The January average for the month of January was 20.25 active cases per day. So that just blew our statistics out of the water for the year in the number of cases and how quickly they were coming at us. The month of February thus far is 4.23 active cases per day. So back to kind of that pre-surge, pre-Omicron type of numbers, and hopefully that will just continue to trail off for us. So when we look at those total numbers, just kind of understanding where we are, where we've been, we have had 212 total cases throughout the year. In consultation with health experts, I think it's probably safe to say that it has been much higher than that with unreported cases and cases that were asymptomatic and were able to stay in school. So that's compared to the 40 that we had all school year last year, that is a significant number. The 212 is 27.6% of our staff and students at some point in time during the year. have had COVID-19 or have reported having COVID-19. So one of the commitments is the planning as we moving forward is that we will continue to be transparent in sharing that data. And I think it's incredibly important that the community knows and sees where our numbers are, where our trends are, so that they can choose the level of protection that they want for themselves and their family moving forward. So we are committed to continuing this count, continuing to update, and I'll continue to update the board on how those numbers are looking at over time. I think one of the really, really important things to talk about and I guess just really acknowledge is through a time period of a month where we were 20.25 active cases per day, we remained open throughout that. You had given me the ability to respond quickly and put masks in place, which I do believe helped during that peak to keep that, from going even higher. But we remained open. That does not happen without the amazing staff of the Bangor School District, working incredibly hard, pitching in for each other, helping out wherever they needed, staff subbing, doing all of those things. That doesn't happen without, unfortunately, without some staff suffering through and getting COVID-19 and returning sometimes before they were 100% ready, but just wanting to get back to help and be there for their kids. So I just want to acknowledge the outstanding work and effort of our teams and all of our staff, top to bottom, making sure that we could stay open and continue to provide that education for kids during that time. So thank you to the entire staff of the district. The other part of this is it has hit everybody a little bit differently. Everybody that's had it has been hit differently. And I don't want to underestimate the significance and how bad some people have felt. It has been the worst, described to me as the worst sickness they've ever had in their lives, longest time they've ever been laid up from work. So I don't want to downplay that, but I do think it's important that we have had through that 212 cases, no major medical hospitalizations or anything like that. And I think we are very fortunate for that to be able to get through that, and people are returning to school, returning to work, and we're able to keep moving forward. With that said, we are seeing and hearing more and more that there may be another wave that could be even more highly contagious than what we have seen, but continuing to be less of the side effects, making it more and more cold and flu-like. And I think one of the things to acknowledge as a district is when we talk cold and flu, the district has never been responsible for preventing 100% the spread of cold and flu. People will get sick. We will respond if numbers get to a certain number, if there's significant spread, if there's hospitalization concerns, and that's always been an epidemic type plan with the Department of Health. And I think that's where we're moving, and that's kind of where the plan document is guiding us. So the proposed plan changes, I'm just going to read the proposals, and that's directly from the plan or the overview of the changes. We feel following recommendations and following practice of many organizations surrounding us, we're going to discontinue contact tracing at this point in time, finding it almost impossible and really at this point in time not very valuable as far as in preventing the spread. I am asking, as we give up, and there was a discussion at our board meeting in December, as we talked about the implications of dialing back restrictions, not giving away our ability as a district to react if we needed to. So putting clearly in here, kind of increasing my breadth of ability to put masking requirement in place, considering if we hit another high level of spread, especially if the intensity of symptoms, hospitalizations, or major medical concerns become prevalent. And we start to see those types of things. I don't want to wait for a special meeting, have a debate about this. I'd like to be able to put it in place. We need to schedule a special meeting see how things are going, and we can schedule that special meeting at that point in time. So I am asking for a little bit more leeway there, and I hope that I've shown that I have done what, use the tools that you've given me to that point and can be trusted to do that in a way that represents the district. We're going to continue to encourage masking for families with an emphasis during times where case counts are high, with an emphasis on people who may be experiencing a simple cold-like symptom or something like that, where they're remaining in school but not positive at that point in time. We're going to ask people to mask more frequently there, encourage parents to send their kids with masks on those days. The vaccinations, I think, have shown continue to be an incredibly important part of fighting this pandemic and hopefully moving this to an endemic where we learn to move forward and function with this as just part of what we do. As much as important as those vaccinations are, the district will not be requiring them. And we have not and will not be requiring any type of vaccination. And this plan will no longer differentiate between timelines based on somebody's vaccination. So we feel like it's the time that parents have had their opportunity to make their choice, and it's not our place to meddle in the choice that those families have made. And as I started, with the data, the district continues to be committed to being transparent with what we are seeing and sharing that information and data out to the community, and sharing those recommendations. In talking with Tammy, our district nurse, we have had multiple conversations that she will continue to be in contact with families that are experiencing positive cases. We'll continue to learn from that. We'll continue to track that data. We'll continue to give recommendations on timelines based on the current timelines that are established, encourage the masking when they return, all of those types of things. But hopefully, ultimately put her in a less, and our staff in a less adversarial where we're enforcing mandates at those times. So we're gonna ask people to do the right thing in that moment. Again, I hope we can stay this way, and I hope we can continue to phase this back and end this. But also, we will have the ability moving forward, if this plan's approved, if conditions change, that we can respond immediately. So that's kind of an overview of the changes. I'm happy to ask or answer any other questions that you guys may have about the plan. Had some time to review it, and we can go from there.
So are we no longer counting the 5 days? Is that what you're saying?
I apologize. Yes, we are still counting the 5 days. And
Okay.
that is one of the restrictions. We are still looking at symptoms
Oh,
that
here
can
it is.
keep
Okay.
keep a child out till they're 24 hours fever free. So we're treating it a little bit differently as far as the requirements act. But we're gonna ask families to wear their mask for the next turn, but we're not going to get up. We hope that people will do that. We trust that people the point.
You update us on where we at with testing? I know at one time, weren't we limiting that or something?
Yeah,
or-
thank you. So in maybe second week of January, first week of January, the state notified all schools that we would continue to be given the rapid tests as quickly as we could be, but there was the national shortage at that point in time. And until they told us differently, we could only use them on staff and not on students. And to my knowledge, the last conversation I had on Tuesday, that has not changed. I can report that we have now started getting shipments of rapid tests again, and we were actually able to get through that peak with the tests that we had. So the rapid tests have been incredibly powerful. We have lots of PCR tests. The problem with PCR tests is the time that it takes to get them processed. And for so many of our cases, we just need to know. So we can still do PCR. We can do PCR tests for students. Families are finding out that if that's the case, they can more easily go get a home kit at this point in time, or they can go to a testing site. So
So if we have a student say, I mean, it says 2 or more of the following symptoms, which are pretty common symptoms, and they took a rapid test, they would be allowed to stay in school as long as it was negative.
Well, depends. There's some of those, if they have 2 or more of them, I'll get to that right page. Then no right now. Let me get to that right page so I can read that. Yep. So they would still be kept home, and those, I would say, the loss or taste of smell we really didn't see with the Omicron, but it's there. Those top list of the single things were in existence before COVID-19.
Yeah.
You know, for the most part, that those people would stay home. We may update that just a little bit more on the shortness of breath and the persistent cough. That may be recommended to be tested, but we may update that. Tammy and I did talk about that, and we did not change it for this rendition.
I guess my only concern is it says if you have 2 or more of the following symptoms, runny nose, sore throat, headache, body ache. I mean, you could have a headache and a runny nose for 2 weeks. I would hope we're not expecting people to
Yep.
stay home for 2 weeks. I mean, if you get a rapid test and it's negative, I would assume that you would be allowed to come to school, right? Just encourage masking.
Yep. What would be, I guess, if we look at that, and I think we can talk through as a team, and we could make an adjustment here if we wanted to make an adjustment. I think that would be appropriate. The 100.4 degree fever would stay. The vomiting and diarrhea would obviously stay in that.
I think the top ones are all pretty much common sense. I would hope people would keep their kids home for that.
Yep.
But the bottom ones, I guess I just am concerned. I mean, you could have a cold that lasts for a week and a half, and yeah, if you have 2 of those and you could take a rapid test and you're negative, I would think, I mean, because we still have colds. I mean,
I think what we could do there is add rapid tests to return with a mask, with a mask recommended.
Right, because as it says right now, if you had 2 or more of those, you would have to stay home until you had 24 hours
24 hours
symptom-free.
Add
So-
rapid test, negative rapid test to return with mask recommended.
that's kind of where I was going with the testing, that if we're able to provide the rapid test and we do have a student with 2 of these symptoms,
Yeah.
if we could just get them, or if their parent approves them to take the rapid test and it's negative, encourage the masking, but
I would support that. I believe Tammy would support that as well. And Dr. Worsing, in my conversations, we talked about that, and then we didn't change it. But I think that would be a reasonable change.
But right now we have no, even if they test negative, this is what we're going off of right now, right? We have no stipulations on negative or positive tests, right? Right now, we don't have any consequences on if you have a negative or positive test.
If you have a positive test, you're out for 5
Well-
days.
Right. But I'm saying there's no way to get around it. If you're sick, you're home. But if you were sick and you test negative, you could still come to school. But you could be in your first phase and still test negative and be symptomatic. I mean, this is a
Correct.
hard line right there, I think.
And that does happen.
I mean, that is part of the problem because you can test too early. I mean, that's very common. I've had people at work test negative one day and positive 2 days later. So,
We have 2 at work with students and personnel.
so I don't know how you put a fine
Right.
description on it.
And that's where you're seeing like test to stay type criteria in some places when the mask or when the rapid tests were more available for students. I'm trying to think how to move forward with that to make sure that we get we capture what you're saying, because you're right. I mean, they can test negative and then come. If we test too early and then they're spreading it.
But Lisa's right too. People can have runny noses and
Yep.
for a couple of weeks and it's a common cold or whatever, and they are negative.
I'm not sure what the number of days we want to put on it, but sore throat, runny nose, for a couple, whether it's 2, 3 days, and then a negative test thereafter, because, yeah, you know, if you're going to have a runny nose for 2 weeks, you're going to be testing positive before that 2 weeks hits.
So we could add the negative rapid test after 24 hours of symptoms, because that's down here. We're saying we're using the 24-hour symptom free. We could just say if they're still symptomatic after 24 hours and they have a negative test after 24 hours. So we're not doing it at the onset. We're doing it at least 24 hours in.
But we're not requiring the test, right? I guess that's my question, because there are going to be people that are not going to want to test.
Correct.
And if they're not, if you're sick on Monday and by Wednesday you're feeling good, they should not have to test to come back on Wednesday.
If they're symptom free,
If they're symptom free, right.
Right.
No, right. I
Okay,
agree with
I
that.
just-
Yeah, if they're symptom free,
Correct.
right.
Then there's no test required, period.
we don't have any tests required right now. That takes us into a whole different conversation.
We will accept a negative test if somebody chose to take a test to return. No,
Can
we don't have that in there anymore.
Requiring a
That
test
was in
is
a
kind of
different
like
version.
requiring a vaccine then. I mean, you can't necessarily require.
No.
I don't think you can require a test.
I'm not in favor of requiring either one at all.
I'm not.
And yeah, I guess it states if you are symptom free, 24 hours symptom free.
So the or down there is that a student may return if a medical doctor provided a note that the symptoms are non-COVID related and the staff or student is non-contagious of any type of communicable disease.
Right.
We could add or a negative test after 24 hours.
Because then you're not requiring it.
Right.
Yeah.
Yeah.
So there are multiple ways that you
Several
could
ways, right.
return. And we've still covered our basis to make sure that we're not getting, so maybe that's the place to add that sentence.
I think that would be good.
Or,
It's a third bullet point.
Yeah,
yep,
I think that's where. I
Yep.
think that's a good place for it.
because then there are multiple ways that we can get there. And again, our objective is to have kids here. I don't want to put barriers in place to get them here, and that's part of what we're working towards.
But not when they're sick.
But not when they're sick.
Right.
Yep.
I mean,
Right.
there can't be a whole bunch of what ifs. Like if you have 3 symptoms, then they should be home.
Yep.
Like,
Yep. Unless the doctor has provided that note saying that it's not COVID and it's not contagious.
You know, in devil's advocate, I mean, those bottom 4, you can see a runny nose. But unless it's really severe sore throat, severe headache, severe body aches, you're not going to know unless they tell you.
And unfortunately, we've seen that abused.
Right.
And then we have some attendance concerns that we're chasing. Am I correct on that, gentlemen? Because, well, they're still experiencing 2 of those symptoms. Well, we can only see one,
Mhm.
and we don't see that. So I think adding the other or would make sense. So with that change there.
So a bullet point, others, under students and staff may return to school, that section.
Yep.
Right here.
Yep. There's the 2. Yep.
But it's a third option for being able to come if they want to come back.
So there's 3 options to come back.
24-hour symptom free without those 2 together.
Yep.
And then a medical doctor's excuse saying that it's
Yep.
not, or
allergies
you
or-
test.
Yeah.
A rapid test after 24 hours of symptoms.
Okay.
We all feel okay about that?
Does that make sense to everybody?
That's to me.
Thank you. That's a good discussion to have. I appreciate that.
So you need a motion to approve this?
With that change, please.
Can I ask just one more question? I know we spent a lot of time on this, but, and it was on here before, so it has staffing closure. Hopefully we're through this and to the end of this, but that is to your discretion at this point, is that correct? Depending on the school or the entire district, or?
Yeah, and I guess I would look at that in a standpoint of, we still have a couple snow days, hopefully we don't use, or what, it would be in that similar vein. We have had rough days with a number of people out, and we've been able to piece together through 20 active cases in a day. I don't foresee that happening, but I think leaving that in place that we may need to would be easier than trying to combine classrooms at that point
Right.
in time, trying
Okay.
to do
counterintuitive.
some immediate switch to virtual when we have that
So it
many
would be
staff
similar
out.
to a snow day.
Say what?
It would be similar to a
Be
snow day.
similar to a snow day,
Okay.
where we would just close, and COVID and snow days both fit under act of God. If we absolutely had to use more than those, we could file a waiver at that point in time to forgive those days. I hope we don't get to that place. Again, we've gotten through the month of January, where we saw that type of numbers. And like I said, our staff has been incredible through that. But I don't want to put kids in an unsafe environment, and I don't want to, put us in a place where we can't, where we're trying to hold on, and we shouldn't be. We should just take the day. And part of that with the 5-day, time period for return, it gets much easier to do a day or maybe 2 days, and then you tie it to a weekend, and we've got the people through it, and we can return to function on the next day.
I will move to approve the revised COVID-19 response plan with the amendment to, as discussed, I should say. Might be easier.
I'll second.
Motion made by Joni, seconded by Lori to approve the revised COVID-19 response plan with the amendment that we discussed. All in favor?
Aye.
Opposed? Motion carried. Thank you. Good discussion. Policy updates, action item, starting on page 23. If you need to look at them.
Yeah, the overview is there. As Joni had mentioned, the non-discrimination policy are almost all federal legal type language and placed in all of the appropriate places. There was not a lot of a lot of discussion around that, just because it's what needs to be there. And then through the other board revisions, we had good discussions. We planned for an hour and a half. We had agreed to that at the beginning of the year, that we wouldn't go past an hour and a half, because our brains start to get fried. I think we were done in about 45 minutes with everything. So discussion went pretty quickly on those. They were pretty basic. Some of the more challenging topics, I would say, he actually had pulled out of that group to get into previous conversations. So this was just kind of a final cleanup of that volume 30. So
Plus, several of these are repetitive according to the class that they're in. So it might look like a long list, but it's, adding the same changes to professional, staff as support staff. So it looks like a longer list than what it probably really is.
So we just look for approval of those policy updates. No new policies in there, so these will all be approved tonight, and we'll be done with them.
I'll make a motion to approve the updates as revisions and special updates on non-discrimination and volume 30, number 2, as reviewed by the PRC.
I'll second.
Motion made by Shelley, seconded by Joni to approve the updates as revisions and special update on non-discrimination, and also volume 3, number 2, as reviewed by the PRC. All in favor?
Aye.
Opposed? Motion carried. Thank you. Personnel, Mr. Brokup, there's 3 different,
Yeah, and I think with some discussion that should be had, maybe we can entertain a motion to take all 3 to closed session, and we'll come back out in action on all 3 afterwards.
I'd like to make a motion to remove or take all 3 of those, A, B, and C, to closed session.
Second.
motion made by Lori, seconded by Joni to take the 3 personnel items to closed session. All in favor?
Aye.
Opposed? Motion carried. Thank you. Administrative reports. We'll start with Mr. Chaplin.
Thanks, Julie. First thing on there is our Reading Drives Achievement Procedural Compliance Self-Assessment. Once every 5 years, the state and federal government require us to look at our IEPs and look and see if that we're, number 1, in compliance with how to write them, and number 2, looking at best practices of how those go. We're in the ending phase of that. It actually started prior to COVID and was kind of extended because of COVID. It starts with like parent surveys and things like that. And now we're into the looking at the IEP parts. And we just submitted our revisions to the state yesterday or the day before. And so they'll review those, and then in the June, they're going to come and then come on site and see if we're continuing to do those revisions with the new ones from March till June. So hopefully that goes well, and then by the time next fall rolls around, they'll complete that, and we'll say we're good for 5 years. So hopefully that all works out. And then my second one is the federal funding conference. This was actually the last thing I kind of did, big thing before COVID, and that was kind of like the week of everything shutting down. So going to return to the exciting world of funding and all the things that go along with that. So
Any questions for Mr. Chaplin? Okay. Elementary school report, Mr. Johnson.
Thank you, Julie. Caring is the word of the month for February. Teachers are working on that in their classrooms, morning meetings. We had the 100th day of school celebrations, along with a lot of candy at the Valentine's situation. My desk is stuffed full of things, fidgets and whatever. Cheryl Lane has agreed to do the long-term sub 4K for Melanie Brooks during her maternity leave. And just an update on the 4K scenario, looking at numbers. So we've talked about implementing a full day, or full days 4K. And currently, you have 2 teachers that are in that position in order to do that. And then we're sitting at, actually, we got 1 more 4K coming in for next year. So 41 students are on our list right now. And I think that that's a discussion that you guys need to have about, that'd be 20, 21 4Kers in a classroom. So just bringing that to your attention, the numbers are coming in. I wanted to share that with you. I also wanted to share, you got the conflict of 87% of the people that responded to the survey that I did earlier wanted the 4-day-a-week full days. So certainly a discussion we have there. So.
Is that 41 confirmed people or just people on our radar?
Pretty much confirmed.
Okay.
I would think there probably is a little variation there, but I'll be honest, I think it's going to go up,
Okay.
not down. But who knows?
Any other
Number
questions?
Number of people purchasing houses moving into town.
Any other questions for Mr. Johnson? Okay, Mr. Mullenberg.
Thank you, Julie. An update on our band and choir trip to New Orleans. Communication was sent out to parents, letting them know about the requirements for testing or vaccination. And then the final payment, and I talked to Ms. Stummel and Mr. Jones. 4 people have since then have dropped from the trip. Some over some of the testing that they didn't feel comfortable with, and a student that wanted to use their money to buy a vehicle, so they opted out. When I asked them, what would that mean for the price for the rest of the people, and they said it possibly could go up just a little bit, but they weren't thinking it would be much if it did, and they're hoping they have enough from their fundraising to cover that. So an update on that, so that they're looking forward to going, and indications are with all the things dropping that hopefully after Mardi Gras and all those things are done, the city of New Orleans maybe will relax some of theirs, just like the rest of the country is doing. So I just want to give an update on that. So I'm looking forward to that. And I know in the consent agenda, there is for the upcoming Spanish trip for next year. I just thought I would throw that in right now. It is next May is what they're looking for approval for. It's the one that goes every other year. Heidi Liga takes upper level Spanish kids. They're going to Guatemala, and that is in the packet. And if you wanted to see, it's an 8-day trip. So if there's any questions you have on that, the dates aren't solidified just yet. She's looking for approval, or we're looking for approval so she can get that rolling and sent out to parents. In Guatemala, yes.
In my defense, the packet that I was given says Antigua Sun at the top of it, but that is part of Guatemala, so yes.
So that's just informational for that for now. So
So the band choir trip is May 11th, is that, or excuse me, April 11th?
correct.
Okay.
Yep.
Any questions for Mr. Mullenberg? Okay, thank you very much. District Administrator Report, Mr. Brockup.
Yeah, I just want to give you some updates on some things that are going on. The Nexus facility study is off and running. We have had a number of meetings, and I am confident I don't have all of them there, but they continue to bring in different teams that are looking at different aspects of our facilities. So we've had an architectural and design team come in and just kind of listen to where some of the struggles for the district, and then go in and start measuring rooms and really starting to calculate out what are options, what's our current capacity, all of those types of things. Our envelope has been assessed. You may have seen a drone if you came by the building. Pretty amazing technology where they set the 4 corners of the building with a drone and then push play, and that drone circles, comes back. They tell it to change a battery, it goes back and it circles, and we'll get these 3-dimensional images where they can go through and they can assess the number of masonry repairs that need to be made, and countless other, where caulk is too thin or too thick or whatever. Pretty amazing stuff going on there. So I'm excited to see kind of what the outcomes of those things are. HVAC has been looked at with those teams. Civil engineers have come in to look at our outside facilities, drainage, our athletic fields, all of those types of things. We've had a specialist come in and look at our stage area and sound and lighting and all of those types of things, just to get an assessment on how those things are going. We had an electrical and low voltage meeting yesterday, which not only takes into account the electrical service, but our PA systems and our camera systems and fob systems and wireless systems. There's a whole lot that goes into that. I know John was, they were speaking his language more than they were speaking mine, and he was doing a great job of informing them and on where the district is there. So we're getting lots and lots of input, lots and lots of ideas on what our current setting is, and what our current conditions are, and kind of then they'll start to develop some ideas for moving forward, and excited to bring those back to the board. I anticipate more of a full report in the March meeting, talking about some of the findings from that group, and just kind of next steps from that. So pretty exciting. I think we admin team is meeting again tomorrow morning, and beginning to kind of get some of the concepts or ideas that they're starting to develop just to get some direction. So excited to get the board involved in that and share with the community what we're finding down the road. School social worker update. I got an unfortunate phone call that our school social worker who is contracted through CISA has taken a position elsewhere and is leaving CISA. That leaves us without our half-time social worker potentially for the rest of the year. CISA is working on options, but we all know what job markets look like right now. And getting somebody to come in that would be able to finish off the year, we're not confident will happen. We will be credited back from CISA for that service if we are not receiving it, obviously. So I do think just after a real initial contact during our conversation during our admin meeting, I would anticipate our team looking at some options for how we can fill that need for the district moving forward that we'll come back probably in March and chat with you a little bit more about, but just kind of a heads up on that. So ESSER 3, again, just kind of provide some updates on that. We've talked a little bit about strategies for how we will approach that $900,000 of ESSER money in ESSER 3. I've had some meetings lately where strategically that first plan that I had might not be the perfect plan. So we're going to continue to evaluate that. But I think the important thing to know is we have not had to dip into that money, so that is fully available. Angie and I are actually looking a little bit closer, and there is a small portion of ESSER 2 left. The bus purchase was the last big purchase, but we've left a little bit of money there, and we just ordered more masks this week. We continue to have to buy some special cleaning products, and I think it's important that we continue to do that. So that's going to be kind of continue to come out of the ESSER 2 dollars, but there's not much to come from. The good news in sharing that money is still available is the extra things that we've done this year as far as the bonuses and those types of things we've been able to cover out of our regular budget. So I feel really good about that, and the flexibility that the ESSER dollars that have a few years to be spent give us. So just kind of a quick update there. Another update, we met with the insurance center just for some information for me and just to kind of get updates on the process and timeline for looking at our insurance benefits for the district. They have started the RFP process, which our district goes through every year. That's putting proposals out to different vendors for insurance. Important part of that is that's going to just help ensure that we have the right information in front of us and help I guess kind of encourage our current vendors to come back with us with the best numbers that they can, because they know that we are willing to look at other options moving forward. So it kind of helps protect us. So we'll be bringing those numbers at an April meeting, some of that information at the April meeting on what insurance benefits might look like and what our options would be moving forward. Not hearing phenomenal things about insurance increases, private sector and in public sector. What I'm hearing is 15-18% increases. We don't have that number yet until after this process has gone through, but those are some pretty significant numbers. So we will continue to work with that and brainstorm and strategically prioritize, as we're committed to do for the district with those numbers. I have on here also the PLC at Work session. We will be taking a team to the PLCs at Work workshop in Minneapolis this summer from August 8th to 11th. And my understanding is a board member has joined that team in the past. So Rick, Mike, and I are going, and I believe 4 from each of their buildings and then 1 of you. So if you are interested in participating in that, and especially if you have not done it before, I hear it's terribly boring, and no, I hear it's very valuable and a really good time. So please let me know if if you're interested in that. Otherwise, we'll be encouraging somebody to join us for that training this summer. So just wanted to plant that seed. And then I think we put it on the agenda next month. Unfortunately, I'm going to have to ask, can we please move the yeah, in 2 months, but I'll put it on the agenda next month to officially change, but just get an idea. Could we potentially move the April meeting to April 19th, which would be a Tuesday night? Is that possible? The week before, week after are not great because of trips and somebody that takes notes for us being on both those trips. So if we could move to the 19th, is that possible? And if so, I'll bring that for action to the next meeting and we'll approve that. I think so. Okay. All right. I appreciate that. So we'll look to move that, and we'll look for action on that at the next meeting. Any questions for me on my reports and things we're working on? Oh,
You
thank
had a
you. I
number
missed the
three.
safety, didn't
Yeah,
I?
I was just gonna say, yeah,
Safety?
safety, yep.
Thank
Safety
you. I
plan?
apologize. And did just so early January, I met with a number of staff members, and we talked about current safety planning. Obviously, we approved the safety plan, and I had shared at that point in time that I think it's a very good plan, and there are really positive aspects of it. And there were areas that I took some notes on that I would like to see evolve over time. Basically, we want to make sure that we're getting our drills in for the year and getting those in sooner than later. So I want to prep staff, and I actually have called a meeting next Wednesday that I'll get staff ready for those drills, and then we will be carrying those out. In doing that, I wanted to kind of make one change before we practice. So that people can understand. So this is something from a lot of law enforcement experience or law enforcement interaction, and I actually met with Chief Allo and talked through this as well, and it makes a lot of sense. Trying to develop something that makes more sense than just the language of a lockdown. Oftentimes when we talk about school safety, we talk about emergencies, we talk about a lockdown type situation, and it can mean a lot of different things. And everybody thinks the worst, and sometimes we need to lock our building or have kids stay in rooms for a period of time because of a medical emergency or something like that in the hall, and we don't want kids in the hall. So what I've experienced and what I'm proposing and what I just want to share with you, not just that I'm going to be communicating with families or with our staff, is that this is a progression. So we have our general operations at the bottom that we operate it within in a daily basis. So our doors are locked. We're checking people in, buzz-in entries, those types of things. We're paying attention to what's going on around us. All those types of things is a typical day for us. Heightened sense of awareness is a situation where we're doing all of those things in a typical day, but we may have been aware because of our relationship with the police department or something that we have been made aware of through a family. There is maybe a parent that we are concerned about, or maybe there is something going on at a property near our school that we want to have just an extra sense of awareness on, that we would maybe notify staff and explain something to watch for during the day. That would be we would be in a heightened sense of awareness. We would just be paying more attention to those types of things. A hold in place is something that's been in place in the district, and this is just defining it. We are continuing all of the same protocols, and students are staying in their classroom. Nobody's passing in the halls. We're not dismissing any students, and nobody's coming in and out of the building. Again, this could be used for a medical emergency, and at times we may have dogs come in from the county and do a sniff for banned substances or something like that at that point in time. So we could just make sure everybody's safe in classrooms. We know that there's not a major emergency. Class continues, teachers continue to teach, do what they need to do, but we just don't need extra people in the hall. A hold and prepare is the next level up from that, and that is we want kids in their rooms, we want them with their teachers, we want attendance taken, we want everybody accounted for, and we may need to take some type of action, or maybe we are looking for something specific. Maybe we need to evacuate our buildings, and we're going to get buses ready to come and pick kids up to take them to a different site. We would go to a hold and prepare where the kids would be in that hold in place type situation, except we are communicating to the teachers through email or through loudspeaker. We need you to prepare your kids for X, Y, and Z. They are going to leave the classroom when an administrator takes them, greets you at the door and takes them to a bus. You are leaving all personal items, or you are taking all personal items, or whatever that may be, whatever that's communicated. But we can communicate during that situation that something else is coming, or you need to be on edge a little bit because something else might happen. So a hold prepare is that next level. We're still very much in a controlled environment at that point in time. And then the unfortunate that we have to prepare for is that active threat or run, hide, fight, which is often when you think of their school and into lockdown, it's the worst case scenario has happened. So active threat, run, hide, fight takes the training that the staff has already begun and worked on with the Alice training and just run, hide, fight, those types of things. It initiates a situation where staff is acting, reacting immediately, taking the best course of action that they've planned through, thought through, and making the best decisions they can for the safety of their students and themselves at that moment in time. So the options-based response. Again, I've never had that situation. I've drilled for the situation, but I've never had that situation at the top. But I've used all those levels below that in my previous experiences. And I think the importance of this is communicating. Our kids this is all very controlled down here, and our kids are safe. We are doing what we need to do, and not necessarily create that same level of panic that maybe a newspaper article or a news reporter out front would love to say Bangor schools went into lockdown today. Well, no, we went into a hold to prepare, and we communicated some things, and we did what we needed to do. We kept our kids safe, and that was all part of the planning that we had in place. So I've seen this play out and play out very effectively, the different levels, and this is something we'll communicate to staff, we'll make available so they'll be visible in their classroom. We'll make this available on our website. So if we explain to parents what's going on, we can explain this in this language and explaining what's continuing to happen at that point in time. So I just wanted to kind of update the board on that's one of the little tweaks that's going to be made. That'll become part of the plan when we approve it next year. But something I want the staff to begin to use that language and be prepared for that language this year. Questions on that? Again, I hope this is one of those things that we talk about a lot and never ever have to use, but we got to talk about it and be prepared. Thank you for reminding me on that.
Okay, next item, removal of items from the consent agenda. Consent agenda items, there's A, B, C, and D. So then, if no removal, I'll ask for a motion for the consent agenda.
I'll make a motion to approve the consent agenda.
Second.
Motion by Shelley, seconded by Joni to approve the consent agenda. All in favor?
Aye.
Opposed? Motion carried. Thank you. Ask for adjournment to closed session under Wisconsin statutes 19.85, para 1, para C.
So moved.
Motion by Lori, seconded by Joni. We'll do roll call.
You said that opposite.
I'm sorry,
It was motioned by
Joni?
Joni, seconded
Oh,
by me.
I'm sorry. Second
all
by
right.
Lori, or is it seconded by you?
Seconded by me. I don't care how you do it, but
I'm sorry. Motion by Joni, seconded by Tina. I apologize. We'll do roll call vote. We'll start with Joni.
Aye.
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 We are now adjourned into closed session. We will return to open session. I have personnel. Ask for motions.
I will make a motion to approve the resignation of Brenda Langer effective 1/28 of 2022.
Second.
Motion by Lori, seconded by Joni, to accept the resignation of Brenda Langer effective January 28th, 2022. All in favor?
Aye.
Opposed? Motion carried. Next, hire for part-time special ed speech support teacher.
I will make a motion to approve the hire of Courtney Piskey to fill the part-time special education / speech and language support teacher position for the remainder of the 21 to 22 school year.
Second.
Motion made by Joni, seconded by Lisa, to hire part-time special education speech support teacher Courtney Piskey for the 21-22 remainder of the 21-22 school year. All in favor?
Aye.
Opposed?
I'll abstain, Julie.
And Shelley will abstain. Thank you. And finally, last, the hire of custodian.
I'll make a motion to approve the hire of Nathan Jones as full-time custodian effective January 31st, 2022.
I'll second.
Motion made by Lisa, seconded by Joni, to approve the hire of Nathan Jones as full-time custodian effective January 31st, 2022. All in favor?
Aye.
Aye.
Opposed? Motion carried. Thank you. I ask for adjournment.
So moved.
Second.
Motion made by Lori, seconded by Shelley, to adjourn. All in favor?
Aye.
Opposed? Motion carried. Thank you, everyone.